what is the right way to diagnose if somebody has a fatty liver? Should we go by the ultrasound? Should we go by the liver function profile? How it should be done?
So when you go to get an ultrasound done, and the doctor performs an ultrasound and he sees the liver as an organ which appears grey. So based on the shades of grey, they report it as fatty liver grade 1, 2, 3 or 4. Should all patients with grade 1 fatty liver on an ultrasound be concerned? That is a question. If we understand about fatty liver, not all ultrasounds which are showing fatty liver actually mean there's a problem. So how we approach that? There are people who are risk of developing higher grades of fatty liver. These are people who are obese. These are people who have diabetes, who have hypertension, who have hypothyroidism, who have sleep apnea, whose lifestyles are are quite sedentary, or they don't have a regular sleeping pattern, lot of stress in their lives. Alcohol intake also leads to fatty liver. So these are the group of patients where we'll be concerned. Yes, this might be a problem. The second thing that we look out for is we'll see for the liver function test. So liver function test is a simple blood test. So a higher grade of fatty liver usually will be associated with some increase in the liver enzymes. By liver enzymes we mean SGOT and SGPT. So you have an ultrasound which says there is fatty liver, and you have an LFT where your SGOT, SGPT is also increasing, and you are obese, you have diabetes, then you should be concerned, yes, this could be a problem. I frequently recommend my patients who are suspected to have fatty livers to get something called as a FibroScan. So FibroScan is a non-invasive method. It's just like an ultrasound. So with a FibroScan, you can make a very good objective assessment as to how much fat is there in the liver and whether this fat is causing the problem.